Hello, this is Gina Piscatelli with a lecture on the male reproductive system for Anatomy and Physiology 2. The picture that you're seeing on this introductory slide is a scanning electron micrograph taken of the inside of a testis or a testicle. And what you can see is a network of tubes that are called seminiferous tubules, which we'll talk about later. The wall of it looks golden colored, and the interior is blue. Those are developing sperm, and you can just make out some hair-like structures called flagella of mature sperm. And we'll look at the structure of the testis a little bit later. So let's first review the organs of the male reproductive system. The primary organ is the testis. Two of them are called testes, and they function to produce gametes or sperm. So what happens in the testis is spermatogenesis. In addition, the testes produce testosterone, which is important for the development of testes and the maintenance of the health of the tissue of the testes, as well as the development of secondary sex characteristics that males have, like deep voice, facial hair, that kind of thing. So those are the two primary organs, right? The two testicles. Then there are other organs that are classified as accessory organs or secondary organs. They include some that are outside the body and referred to as external genitalia, including the penis and the scrotum, which actually houses the testes, and then the spermatic cord, as well as glands and ducts that are interior. The function of all these accessory organs is to deliver sperm to the female reproductive tract. Spermatogenesis, the making of sperm, happens in the testicle, and the rest of the organs are all about delivering that sperm to the female reproductive tract. So we're going to examine the anatomy as well as the physiology of these organs. And we're going to start with the external genitalia, the penis and the scrotum. And then we'll look at the interior glands and ducts used to deliver that sperm. And then finally, we'll look at the structure and function of the testes. So I'll start with the scrotum, which houses the testes outside of the body cavity. It's kind of made up of two sacs with a septum in the middle, which separates the two testicles. And it's composed of skin, of course, superficially, and then some connective tissue that we call fascia, some smooth muscle that's been named the cremaster muscle. I don't know how it got that name. It's an interesting name. And of course, there's blood vessels in there. So the function of the scrotum is to have a place for the testes to reside outside of the body cavity, because the body cavity is too warm for spermatogenesis to occur. So the scrotum helps to regulate the temperature of the testes and keep them cooler than what we think of as body temperature. The cremaster muscle helps with this, being part of the scrotum. As I mentioned, it's smooth muscle, so it cannot be voluntarily contracted. But when it does contract, that elevates the scrotum, which elevates the testes, and this is necessary when environmental temperature is too low for spermatogenesis. So contraction of the cremaster muscle will cause the testes to rise in order to increase their temperature for spermatogenesis to take place. Okay, let's look at the spermatic cord next, because it really kind of begins within the fascia of the scrotum, and it extends all the way to the inguinal canal and just inside of it. Let's talk about what it contains. It contains this smooth muscle we've already talked about called the cremaster muscle, because the cremaster muscle extends superiorly. And it also contains a network of veins called the Pampiniform plexus. And those are shown in blue in this diagram superficially. Deep to the Pampiniform plexus is a testicular artery. It's hard to make that out in this picture. I can see just a little bit of red there, but you'd have to magnify it pretty good. Believe me, there is a testicular artery that's deep to the Pampiniform plexus that's supplying blood to the testes and the scrotum. Also within the spermatic cord is a duct called the vas deferens that leads from the testes to the inside of the body. So inside the body, the spermatic cord consists of everything except for that cremaster muscle and the plexus. There's a vein, but not a plexus. There's a testicular vein here. And so the spermatic cord inside just doesn't have that cremaster smooth muscle. So this vas deferens, as you know, carries sperm from the testicle where it's made to the inside of the body cavity and eventually will join up with the urethra in the penis, from which it can be ejaculated. Before we talk about one other structure labeled on here called the inguinal canal, I'd like to talk more about this Pampiniform plexus because it is ideally designed to regulate the temperature of the testes. So a plexus is a network, and I don't know what Pampiniform means, but what we have a testicular vein that's carrying blood up to the body cavity. But notice there's this network of vessels surrounding the testicular artery. And the artery is carrying blood from the body cavity to the testes. So down here is the testicle. And here's one, the same testicle, sorry. And blood's returning into the body cavity. Inside the body cavity, the blood is warm. It's approximately 39 degrees Celsius. So it's quite elevated. And we need a temperature of 34 to 35 in the testes for spermatogenesis to occur. So this warm blood comes down in the center of this network of vessels. And that's ideally designed because heat radiates from areas that are hot to areas that are cooler. And so we have warm blood central, surrounded by blood that's cooler. And so the heat is going to radiate towards the venous system. Excuse me. So what happens is heat is absorbed by the Pampiniform plexus from the arterial blood. And so as the blood travels back to the body, it's going to be warmer, which is good. And the blood that's going down to the testes is cooled. So the arterial blood is cooled before it reaches the testes. It's perfect design. It's called countercurrent heat exchange. Okay, now we can think more about the spermatic cord and the passageway through which the structures pass into the inside of the body, the abdominal pelvic cavity. This passageway is called the inguinal canal, and it's generally kind of a weak spot in the body wall due to the fact that it needs to be weak so that the spermatic cord can descend during development so that the testes come to reside outside the body. Of course, as males develop and grow, connective tissue is laid down around the spermatic cord, hopefully tight enough to prevent herniation. Herniation is the protrusion of a structure through some tissues that normally contain it. So, for example, we have the small intestine that's normally contained by connective tissue and muscles of the body wall. Herniation occurs when the small intestine protrudes through that tissue. So this is called an inguinal hernia because it's passing through the inguinal canal. Now you know there's surgical procedures to fix this or correct this problem. It does require a surgeon, because although maybe anybody could push up the inguinal hernia, the small intestine I mean, then you need to reinforce this region with meshwork, but not damage the spermatic cord. So that would take some expertise. Okay, the next part of our external genitalia includes the penis. And the penis consists of a root and then a shaft, and at the very tip is an enlarged region called the glans penis. The skin covering the penis is generally loose because it's going to elongate and become enlarged excuse me, during an erection for sexual reproduction. And so the skin needs to be able to accommodate this change in diameter as well as length. At the very end of the penis, where the glans penis is located, this distal region, is kind of a cuff of skin that forms what we call the foreskin. You can see it on this enlarged picture over here. Sometimes the foreskin is surgically removed shortly after birth, and that procedure is called a circumcision, which I'm sure you've heard of. Now, a circumcision is not considered medically necessary, but it might decrease the risk of acquiring infections, reproductive infections. And it turns out in the U.S. about 60% of newborn boys are circumcised. The other thing I'd like to mention about this anatomy and the picture you're looking at is that this surface that you're looking at of the penis is referred to as the ventral surface. It is named ventral because an erect penis kind of, I guess, is pointed upward. And so this really truly is the ventral surface during an erection. And I guess that's most important because we're going to see that the urethra is slightly ventral. It's not in the very center of the penis. So if we look at a sagittal view first of the penis, we have the root and the shaft and then the glans penis. Now this picture on the left, the sagittal view, is of a flaccid penis. But during an erection, the penis is going to tilt or turn upwards. And so this surface will be close to the body wall. And this surface, the ventral surface, will be more superficial. And so that's how it's named. And notice that the urethra, which is colored red, is not exactly in the midline. I guess you could say that a third of the tissue is ventral and 2/3 of the tissue is dorsal. And if we look at a cross section, that seems to be about right. So this is the ventral side over here. And we see this vascular tissue surrounding the urethra. And then dorsally, we have two big bodies of vascular tissue surrounding deep arteries. Now those three vascular spaces that are colored blue here are called erectile bodies. So there's 3 erectile bodies that fill with blood during an erection. First, let's name them, and then we'll talk about how it works a little bit. So the erectile body surrounding the urethra is called the corpus spongiosum. And the dorsal erectile bodies are called the corpora cavernosa. That's plural for 2 cavities. If you're just talking about one of, or not cavities, but erectile bodies, if you're just talking about one of them, it would be corpus cavernosum, just to teach you a little bit of an Latin, I guess. So arterioles supply blood to these regions, this erectile tissue, and those arterioles are normally constricted until sexual arousal occurs or excitement. So sexual arousal triggers a parasympathetic reflex that causes the wall of those arterioles, the endothelium, to release a chemical called nitric oxide. And nitric oxide, like we learned about in the circulatory system, is a potent vasodilator. And so the arterioles vasodilate, as well as any veins in the region. And these spaces are engorged with blood, fill with blood. And that makes the penis enlarge and stiffen to accommodate sexual reproduction or insertion into the vagina. Okay, now we can move a little bit interior, and I'd like to talk about just the anatomy first, and then we'll look at the function. So internally, the male reproductive system has a set of glands and ducts. So let's look first at the glands. So there's a seminal vesicle that's on the posterior surface of the urinary bladder. So you can see the urinary bladder is this big circular structure, receiving the yellow ureters. So that's part of the urinary system. And then we have the seminal vesicle, which is yellow. And in this picture, it looks like the seminal vesicle is attached to the ureter, but that isn't true. The ureter enters the bladder right here. There's an opening right into the bladder wall. The seminal vesicle, although it looks like it's in this position to receive the ureter, is actually a dead end right here. There's only one opening, and that opening is called the ejaculatory duct. Remember, when we talk about glands, we want to talk about whether or not they have a duct or not. And so this one does have a duct. So it's not an endocrine gland, it's an exocrine gland. And the ejaculatory duct leads into the urethra. Now I'd like to move to the vas deferens or the ductus deferens that carries sperm and some testicular fluid into the body cavity. And notice that the vas deferens or the ductus deferens has this enlarged region called the ampulla. That ampulla can contract. And when it does contract, that helps eject sperm from the vas deferens as well as the fluid into that ejaculatory duct. So two things are connected to the ejaculatory duct: the seminal vesicle as well as the ductus or vas deferens. Now from there we have the prostate gland, which sits inferior to the urinary bladder, and in the center runs the urethra with its own separate wall, epithelial wall. And so this urethra, this region of the urethra, is called the prostatic urethra. Then the urethra passes through the body wall, which is shown here kind of as a muscle, horizontal, connected to pelvic bones. And the urethra that runs through the wall of the body is called the membranous urethra. Then, of course, the urethra continues down the length of the penis, ventrally, right? And that part of the urethra is called the spongy urethra. Now, as the sperm are ejaculated and the testicular fluid, the prostate will actually secrete fluid into the prostatic urethra. And there's also a set of glands called the bulbourethral glands that kind of sit in the body wall or close to the body wall. They're very tiny. And they secrete fluid into this spongy urethra. So to summarize, the ejaculatory duct receives sperm and testicular fluid that was in the vas deferens. Seminal vesicle fluid. Those two things. Two things. That's supposed to be a two. There we go. The urethra receives a lot. The urethra receives the same, the sperm and the testicular fluid from the vas deferens. That seminal vesicle fluid that we already talked about, plus secretions from the prostate and the bulbourethral glands. So this fluid accumulates and has a total volume. And we collectively call all these fluids that the sperm is suspended in semen. So semen consists of both sperm cells and this nutrient-rich fluid that bathes the cells. Now we're going to talk about the functions of semen. So sperm are not able to swim, or they're not self-propelled within the male reproductive system. They're only self-propelled when they enter the female reproductive tract. The way that sperm move through the male duct system is due to just the movement of fluid, both testicular fluid and seminal fluid. So as more and more is produced, pressure builds up and it causes fluid movement. Kind of the path of least resistance is the way that the fluid moves. Now, the main functions of semen are aimed at enabling sperm to become motile or swim on their own, sperm motility, inside the female reproductive tract, because they're going to have a long trip once they're in the female reproductive tract. Also, for helping the delivery of sperm, because it needs to be in a fluid environment, and it needs to stay alive, so it's going to have to protect the sperm somewhat in terms of pH anyway. And once it is in the female reproductive tract and able to self-propel or move, eventually it's going to need to kind of adhere and not move so swiftly. We want to keep a high concentration of sperm near where the oocyte or ovum is located to have a better chance at fertilization. And so there are some components of semen that help the sperm actually adhere to the female reproductive tract. So let's look at some of those components of semen. So first of all, per ejaculation, usually semen and the sperm amount to about 2 to 5 mils, which isn't that big of a range, but somewhat of a range. And within that 2 to 5 mils is 20 to 150 million of sperm for each mil, right? So that's a lot. The pH of the semen in which the sperm are suspended is alkaline. Typically, it's at 7.4 or 7.5. But it can range, but it's always alkaline. And the semen quantity is, or volume, is due approximately to sperm and a quantity of 10%, but 90% of the semen is due to all the fluids that are secreted. So seminal vesicles contribute about 70% to the volume, and it's like a yellow fluid that's really important for neutralizing the acidic environment of the male urethra, because urine is acidic, as well as the acidic environment of the female reproductive tract. But it contributes a lot of carbohydrates for an energy source that the sperm can use to make ATP. So there are other components that balance pH. The prostate secretions have an alkaline pH, the bulbourethral fluid does, even the testicular fluid does. So the seminal vesicle makes a lot of carbohydrates, fructose in particular, that the sperm can use, can break down to make ATP. Okay, the prostate secretes about 20% of the volume of semen, and it's more white colored. And one component that's really important that comes from the prostate is a chemical called prostaglandins. And they help aid in the motility of sperm in the female reproductive tract, mainly by thinning the mucus that's found in the female reproductive tract. This mucus is found at the cervix of the uterus. So with the prostaglandins, the sperm can kind of get through that mucus and up into the uterus. The bulbourethral fluid lubricates the urethra as well as the glans penis. And again, I mentioned that its pH is alkaline, so it neutralizes the acidic male urethra. Okay, so that's the end of our secondary or accessory organs, and now we're going to move on to the primary organ of the male reproductive system, the testicles. Each testicle is surrounded by two membranes that we call tunics. The tunica albuginea is deep, shown here as kind of white. And the more superficial tunic is the tunic vaginalis, which is actually double layered. And it's derived from the peritoneum. So what that means is the spermatic cord, as well as the surrounding of the testicle, takes part of the peritoneum from the abdominal cavity as the testes descend down through the inguinal canal. Anyway, there's two tunics surrounding the testicle. And notice that the tunica albuginea has some partitions, they're called septa, that divide the testes into regions that we call lobules. So each lobule contains a network of tubes that you can see pretty easily. They're yellow, and they're called the seminiferous tubules. This is where spermatogenesis takes place, actually in the wall of the seminiferous tubule. And as the sperm develop or form, they travel in the lumen of this seminiferous tubule to these ducts or passageways that make up what's called the rete testes, and then out of the rete testes in efferent ductules to reach the network of tubes in the epididymis. And the epididymis is where sperm mature and are stored until ejaculation. And notice that the vas deferens or the ductus deferens leads right to the duct of the epididymis. Or I should say the duct of the epididymis leads right to the vas deferens, because that's the direction that sperm will flow. All right, let's look at the different types of cells that are located in the testes. We're just going to look at 3 different types of cells. So first, I'm going to outline on the top picture a seminiferous tubule. So here's a seminiferous tubule in a lobule of the testes. And its wall has epithelial cells, stratified cuboidal epithelium. And some of these cells are germline cells, which means those are the cells that have the capability of differentiating into sperm. But also in the wall of the seminiferous epithelium are some cells called cystenocytes, which I have a really hard time saying, so I call them Sertoli cells. They used to be called nurse cells, which was even easier. These Sertoli cells that are also located in here, and you can't tell which are which, they aid in the process of sperm production because of what they secrete or make. And we'll look at that in a little bit. So this wall is where spermatogenesis is going to take place. And there's 2 kinds of cells there. Now let's look at the bottom picture because it's kind of more fun to look at. You can clearly make out individual cells in the wall of the seminiferous tubule, but you can also make out some mature sperm with flagella in the lumen of the seminiferous tubule. And in between tubules, so here's a tubule, whoops, there's a tubule, and here's sort of part of a tubule. In between tubules are more cells as well as blood vessels. And the cells that the arrow is pointing to are called interstitial cells, meaning in between, I guess, the seminiferous tubules. They were originally called cells of Leydig or Leydig cells because of whoever discovered them. These cells are really important for the function of spermatogenesis as well because they make testosterone, which is required for spermatogenesis to even initiate. So now we're going to look at a little bit more detail the functions of these cells, even though I've talked about many of them. The spermatogenic cells of the wall of the seminiferous tubules are really at various stages. They could be germline cells called spermatogonia. That means they're kind of like stem cells. Or they could be primary spermatocytes. That's the first stage of development. Or secondary spermatocytes. That's the next stage. And then the third is spermatids. So those are all in there. And then there's these Sertoli cells that I said are needed close by the spermatogenic cells in the wall to aid spermatogenesis. And the reason they aid spermatogenesis is because they release growth factors, nutrients, and this compound called androgen binding protein. It binds testosterone. So in here is what we're talking about in the wall. Now, those Sertoli cells also secrete fluid, and I'm calling that testicular fluid. I guess you could call it Sertoli fluid. And so all of that, the fluid, as well as the developing sperm, are going to enter the lumen of the seminiferous tubule. Now, the function of the interstitial cells that make this kind of triangular formation, or the cells of Leydig, those are the ones that make testosterone. And so the testosterone, as you know, is a hormone that will just diffuse away from the site of secretion. Some of it will enter the bloodstream, but it's advantageous to keep it close to these spermatogenic cells because you need a certain level of testosterone present for any spermatogenesis to occur. So that's what this androgen binding protein does. It binds up testosterone. And that testosterone is needed for spermatogenesis to occur. The other thing that's really cool about the Sertoli cells making this fluid, this testicular fluid, is that as sperm develop, their heads actually remain sort of attached to the wall, and their tails or flagella protrude into the lumen. And it's just the movement of the fluid, this testicular fluid, that dislodges them from the wall so that they'll move along into the rete testis and then finally into the epididymis where they're stored. So that was a lot about the testis, but we have one more structure, and that's the epididymis. So recall that the seminiferous tubules, that's where the sperm are being made. And due to fluid movement, the sperm are going to move first into this rete testes. I guess that means network. Remember reticulum meant network, so I think that's where rete comes from. And then we have the epididymis, which has a head region and a tail region. I don't care that you know about that. But this is where sperm mature and where they're stored. A lot of them are stored in the tail region down here that we identified actually in our dissection and models. So what does the epididymis do? Well, it reabsorbs the cells lining the epididymis duct, reabsorbs some of that testicular fluid. So what you have remaining are mature, densely packed sperm in the tail of this epididymis. And they stay there until the time of ejaculation. They can survive there for 40 to 60 days, but I have to say that that number varies quite a bit. Even your textbook says that they can survive for several months, but I've never seen that actually in print. I've seen the 1 month to 2 month thing. So sperm that aren't ejaculated by that time frame, whatever it is, 60 days or several months, they will be phagocytized by cells in the epididymis. So they won't just stay there and die and become necrotic. They'll actually be taken up by other cells, and their components can be utilized to make new cellular structures. Okay, that's the end of this lecture on the male reproductive system. There's one more about regulating spermatogenesis. Thank you.